Welcome back. So in this video, we'll talk about different medications that some people are on to manage their blood sugars. We'll go through a few common medications and we can talk about how they work and different side effects that can happen when people do start medications. Not everybody that's living with diabetes is going to go on medication. So some people can control their blood sugars just with exercise and diet, but some people do need to go on medications just to make sure their blood sugars go back down and that they're in targets so that it's safe for the long term and you're avoiding you're limiting any kind of complications that can happen with diabetes. Everybody's different too, so not everybody's going to be on the same types of medications. Some people will be on different medications depending on other medical conditions that they're on. So it's good to have a chat or a conversation with your healthcare provider just to see if there is better medication options for you out there, which medications would be good. And depending on if you have coverage or if you have insurance, things like that, it can kind of dictate what kind of medications that you will be going or that you could go on also. So this first class of medication here, basically the most common that you will hear is metformin, and usually metformin is a first line agent. So typically when people do go on medications due to high blood sugars, they will start with metformin depending on if it's safe for them to do so, but it is kind of the first line agent usually. It helps to lower your blood sugars by two different ways. So it helps your body, it helps the insulin that your body's producing work a little bit better, so it helps it do its job a little bit, which if you remember one of the first videos we talked about insulin, and one of the function is that it helps the sugar that's in your blood go into your different organs and your different muscles so that your body can use it for energy. The second way that it works, it helps control or lower the amount of sugar that your liver is going to kind of put in your blood. So in the liver, there's little reserves of sugar. So when your sugars are starting to go down, your liver can put a little bit of sugar in your bloodstream just to kind of keep your blood sugars from going too low. But metformin helps to kind of lower that amount so that your blood sugars are not just kind of continuing to go up. There's different doses of metformin. Some people will be on a long-acting metformin, which will be used just once a day, and some people will need to take it multiple times a day. So it's a good idea to just follow the way that it's prescribed for you. It is a lot easier if you do take it with food. One of the most common side effects with metformin is any kind of stomach issue, so like gas, diarrhea, constipation. But typically, if you start at a low dose, you gradually increase to the dose that was prescribed to you. And if you take it with food, you can limit any kind of side effects or anything like that. If you are at risk of dehydration, like we talked about in a previous video, if you are dehydrated or if you cannot take enough fluids by drinking it, it is a good idea to stop the medication until the symptoms go away and until you feel better and you can drink some fluids again and you're not dehydrated at the same time. So a second class of medications that we'll talk about is they are called SGLT2 Inhibitors. Basically the way that they work, they help reduce the amount of sugar that is in your body. So basically they help the sugar go through your urine. So you help to pee out some of that sugar. So it helps to lower your overall blood sugars. Some common names that you might see are medications like Invokana, Forxiga, Jardiance. All of them have different doses as well, and they are taken once a day depending as directed, I guess, by your healthcare provider. They do help to kind of lower your blood sugars, and they do have, for some people, they do help them lose a little bit of weight as well. And they are not known to, or in rare cases, they might cause low blood sugar, but it's only going to be in rare cases. Different complications or side effects that might occur with this medication, things like yeast infections, urinary tract infections like UTIs. Some people will experience low blood pressure. A little increase in cholesterol sometimes. So it's a good idea, especially if you're on a blood pressure medication, just to discuss this with your doctor and just to keep an eye on your blood pressure at home. Like I said, it might cause lower blood pressure, so if you're already on medications to lower your blood pressure, maybe they do need to be adjusted a little bit. One of the most, or one of the rare side effects, and it might be a good time to call your doctor or go to the ER. If you ever have any nausea, vomiting, any lack of appetite, abdominal pain, excessive thirst, any difficulty breathing, confusion, unusual fatigue, sleepiness, it would be a good idea to call your doctor just to make sure that it's not the medication that's causing any of this. It's the same idea as metformin before. So if you are dehydrated, if you can't take enough fluids by mouth, it is a good idea to stop this medication until the symptoms kind of go away. The next set of medication, insulin secretagogues. So if you, some common names that you might hear like gliclazide, glyburide, like diabeta, different doses for all of those medications as well. And most of them will be taken at your meals or before your meals and at the same time each day. And basically what they do to help your pancreas produce a little bit more insulin. So they help your body make a little bit more insulin so that you have more insulin working for you, and it helps to bring down your blood sugars. There is a risk of low blood sugar with this medication just because it is helping your body make a little bit more insulin, so they might, it might cause low blood sugars. So if you are on any of these medications, it might be a good idea just to have a meter at home to check if ever you're feeling any symptoms of low blood sugars. This is probably the most common side effect associated with this medication, so low blood sugar. And then the next class of medications that I'll talk are called DPP4 inhibitors. What they do, they act when, like after a meal, when your blood sugars increases after you eat, your insulin level, it's gonna help to increase your insulin level, and so that's gonna help to lower your blood sugars, but it's also gonna help to decrease a level of glucagon. Basically, glucagon is a hormone that raises your blood sugars. So it's gonna help to decrease that, so overall it's gonna bring your blood sugars down a little bit. So some common medication that some people might be on, like Tradjenta, Januvia. There's also different combo medication. One of the most common is Janumet, which is Januvia and Metformin combined. And they are taking different doses depending on the medication, so just making sure you're taking what is prescribed by your doctor or your healthcare provider. And the risk of low blood sugar is rare for this class of medications. It's not known to cause low blood sugars. Some of the side effects that might happen, so most of the time it is very well tolerated. For some people, it's not known to cause any weight gains or anything like that, but it can cause like joint pain, and very rare complication might increase the risk of pancreatitis with this class of medication. So that's just something to kind of keep in mind and should be aware of at the same time. And then the last class that we'll talk about is, they are called GLP1 receptor agonists. Basically, they act as well when your sugars are higher than normal. They help to increase your insulin level, so it helps to lower your blood sugars, and then they help to kind of decrease your glucagon. So same thing as the last class. And they also they also help you to slow the emptying of the stomach so that you're feeling full for a longer period of time. And they are known to have an effect on weight. So they are known to cause weight loss, which for some people, it might be that might be one of the reasons that they go for a medication like this. Some of the common one, like Ozempic, Victoza, and the medications here, most of them are an injection, and some of them are a weekly injection, some of them are a daily injection. It is non-insulin, but it is a medication that you have to inject. Some of the common side effects associated with like stomach, so some people will feel nausea, especially when they are starting the medication. It can improve over time, so sometimes just giving it time to see if it improves. But it is a good idea if you are experiencing any side effects for a long period of time, just to have a chat with your healthcare providers. For some people, they do go on insulin. Not everybody will go on insulin. If for people with type 1 diabetes, they do require daily insulin, so every time that they eat at their meals, and they will be taking like a long-acting insulin as well. For some people with type 2, they might go on insulin at some point in their life. Typically, they'll start with long-acting insulin. So that's an insulin that can work for a long period of time, and it is taken usually just once a day. And for some people, especially if their sugars are staying high, even if they're on a long-acting insulin, they might be going on mealtime insulin or short-acting insulin. So that's taken after or before they eat, and it's going to affect their blood sugars after a meal to hopefully avoid any kind of spikes and keep their blood sugars in target. But it's a good idea, especially if you have questions about medications, what can be right for you, depending on your different medical condition, medical history, things like that, just to have a chat with your doctor or with your healthcare provider to kind of see what kind of medications would be good for you.